Hello, and welcome to Calling CDCA Volunteers live from Nicaragua. We are very glad to have you with us today. It's good to see everybody's faces. Thank you so much for joining us. And if you have not signed in with your name and your email over in the chat or someplace like that, if you would please do so we have a record of the folks who are attending. We are really glad to have you today. As you know, we are in Nicaragua, and we have invited you, particularly those of you who have been volunteers with us, to get an update on what's going on down here. Because together, around the world, we are facing the coronavirus. It has impacted everyone's lives, some dramatically by losing a loved one, some by having to work while in fear of getting the virus, some by working from home, and some by not working at all, but staying at home. COVID-19 has turned realities topsy-turvy, especially in developing countries like Nicaragua, the second poorest country in the Western Hemisphere. Here, our neighbors, people that you know as volunteers here yourselves, face the virus without all the options wealthy countries have, such as adequate funding for health care, and are instead dealing with the impossibility of social isolation, with the fear of starvation if daily food cannot be bought and sold. With that reality, in contrast to what you might be hearing on US news or what you might be experiencing in your own communities in regard to COVID-19, the Nicaraguan government has chosen to be active in identifying cases and trying an aggressive treatment of public health education without shutting down the country, implementing actions suggested by the World Health Organization that we all recognize are of value, such as social distancing in businesses and government offices, tracking people who come into the country for 14 days whenever possible, and following up with contact tracing, isolating and quarantining anyone testing positive for COVID-19, even while we all understand that some of the tests are unreliable. Mayors' offices are disinfecting with bleach in schools, markets, churches, and other gathering places, while taxis and public transportation cooperatives are coming up with creative hand-washing ideas while encouraging the wearing of masks outside the home. Using South Korean tests, free testing for COVID-19 is happening in public health clinics with people who have symptoms, as well as random testing of people who seem to not have any symptoms, but tests are limited. Expanded services mean that now 19 hospitals, 562 intensive care beds, and 449 ventilators are available, covering all major cities, services far beyond what you saw when you were here. Medicine, along with doctors from Cuba, is also available. In May, Nicaragua had a steady increase in COVID-19 cases. People are afraid of the impact, and it has now spread in crowded urban regions. While the number of confirmed cases is continuing to climb, our fingers are crossed as reported statistics are showing hopeful signs of fewer new cases in June. As you worry over medical costs and health insurance, here in Nicaragua, health care is a guaranteed right, which means that when one does need a hospital or clinic, they leave after treatment with no bill, no debt. Nationwide, over 4 million people, more than half the population, have been reached through visits from lay health promoters who give written and oral instructions on how to prevent and identify the virus, while annual vaccination campaigns continue and are even being carried out on horseback. Public schools are encouraging students to study from home, sending in their homework by WhatsApp, but are keeping schools open for children who can't stay at home and who depend on the free daily meal for their nutrition. Hand washing stations are at bus stops, schools, and other public places, as well as cleaning mats for the bottom of shoes. As you know, Nicaragua shares soft borders with Honduras and Costa Rica. When people cross those borders illegally, the Ministry of Health cannot register their health status. This has created an increase in contagion without the aid of routine follow-ups through the Ministry of Health. Together with you, we have been watching the count of COVID-19 cases worldwide. There have been few confirmed cases here until the last month, but government reports show that cases rose dramatically with community transmission, and self-isolation is extremely difficult in a developing nation, as you know, with 70% of Nicaraguans working in the informal sector, selling in markets and on sidewalks. It means that if they don't work, the little bits of daily income stop and children do not eat. Also, you have seen how many live together in small, basic houses with an extended family of sometimes 10 people. These little houses are crammed together, abutting one another. You've visited families in them in Nueva Vida. And in the tropical heat, families cannot stay shut inside their little homes. Even though most of Nicaragua is trying to social distance, this also poses difficulties for the poor. Public transportation and markets are closely packed, where most shop for their daily meals, as most of you have experienced. The bottom line is that people who are poor in developing countries have to decide between going hungry or risking the virus. And more importantly, they have to decide this choice for their children as well. Can you even imagine a choice like this? I cannot. You have helped this work by volunteering. Your help is needed again. Together we can keep Nicaraguans from having to make the choice between hunger and risking the virus. You know that we are a small organization. We, the Center for Development in Central America, strive to give people the freedom of choice. Beginning back in 1994, yes, for over 26 years now, we have been here, and so have many of you. But just as a reminder, the CDCA is the Nicaraguan project of the U.S. 501c3 nonprofit, the Jubilee House Community, working in health, including public health education, along with potable water and latrines, sustainable agriculture, and sustainable economic development, which mostly focuses on support for organic farmers, also caught in supply chain crises with COVID-19, just as your farming neighbors are caught. Even organic coffee exports to you have been affected, as U.S. roasters and coffee shops closed this spring, leaving the growers and their families with uncertain income. Nicaraguans face the impact of outside nations' influence on society, health, and economics. Throughout the centuries, you'll remember that foreigners have controlled Nicaragua, restricting its right to flourish or to choose its own path. Most recently, in 2018, there was a political uprising backed by the U.S. State Department with the goal of overthrowing the elected government. The U.S. imposed sanctions on Nicaragua and continues to impose new sanctions, which limit the choices this small country has in a time of a pandemic. These sanctions hurt the farmers, businesses, and all aspects of the Nicaraguan economy, including our work. Because the U.S. State Department posted high travel alert levels in 2018, committed volunteer delegations, including some of you, suddenly all canceled, resulting in a loss of cash and medical donations to the CDCA, which were already anticipated, around $150,000 annually, a large chunk of our health clinic's budget. Then, as delegations were just starting to return with their donations, early this year, COVID-19 hit with travel restrictions. You couldn't get here, and the budget's donation loss continues. Especially impacted through loss of our volunteers, our project, the Nueva Vida Clinic, has been hit hard financially. For over 20 years, many of you have worked on and in the clinic, and as its staff serves the poor in its barrio, its neighborhood of about 16,000 people. This barrio of Nueva Vida was founded in 1998 as a refugee camp after Hurricane Mitch hit, the deadliest hurricane of the 20th century. Some of you remember those days, digging post holes in the mud, and were greatly impacted. Like all the poor around the world, the people in Nueva Vida are a prime example of those suffering from all the hardships I've mentioned above. Our clinic now serves not only these people, but 3 rural communities, including the coffee cooperative at El Porvenir that you visited, as well as many others in Ciudad Sandino, the city that encompasses Nueva Vida. With a population of about 180,000 people, Ciudad Sandino is the most densely populated and poorest city in Nicaragua, and as you know, our home. Our clinic cannot treat patients with COVID-19. Instead, we have worked and will continue to work as we can, treating our regular patients while keeping them and our staff safe. Many of our clinic staff have been working with us for 10 to 20 years. You have worked beside them. Not only our clinic staff, but bending rebar and mixing concrete, building and expanding the clinic facilities. And our staff have a variety of pre-existing conditions, all of which make protecting them a priority. We are worried for our staff and our patients. So worried that the clinic has been closed since mid-May, closed until at least July because all 3 doctors got COVID-19. They need time to recuperate, and we simply do not have adequate quality of personal protective equipment. Office staff continue to function, sheltering at home, moving office computers and files to home locations, meeting with social distancing as necessary. Up until the decision to close, we tried hard to adapt at the clinic to address the coronavirus, buying cleaning supplies, making and purchasing PPE for clinic staff, as the evidence of many probable cases of COVID-19 in Nueva Vida kept rising. We instituted social distancing, using Rogelio's crew to mark on the floor where people can stand in line. We also sat patients apart, both outside as well as inside. Danelia and others taught patients several times a day about coronavirus symptoms and how to protect themselves. We set up hand washing stations in front of all entryways into the clinic. Isamar and Amir used thermal scanning thermometers and pulse oximeters to test patients and staff as they entered the clinic. Patients with symptoms of COVID-19 were isolated and sent to a public clinic that does have testing abilities. We scheduled for Rogelio and Lucas to fumigate with bleach solution 3 times a day in the clinic, and if a patient appeared to have COVID-19, they fumigated again after the doctor saw the patient. Our clinic staff wore masks, face shields, and lab coats, which stayed at the clinic for laundering and cleaning. Even though most of our PPE were handmade, they did provide some protection, but obviously not enough. Beginning mid-April, we limited the provided services to only essential care, putting our numerous support groups and home visits on hold to avoid putting patients and staff at risk. So that up until mid-May, Dr. Jorge, our radiologist, did ultrasounds for critical needs and prenatal care. Dr. Victoriano, our pediatrician, treated sick children. He continued to treat asthma in children, although we had stopped all nebulizing treatments, instead using inhalers, individual inhalers with disposable cups as masks for babies and young children. Dr. Elizabeth, our general physician, saw sick patients in the clinic. Isamar, our nurse, did prescribed injections, EKGs, as well as family planning, including birth control implants, IUDs, pills, and injections. Josefa kept our pharmacy functioning with glass all around it to limit germ transmission. We stressed that the elderly and patients with diabetes and hypertension send younger members of their families to the clinic's pharmacy to collect their monthly medicine rather than coming in themselves. But now, Danelia is packing up meds, and with Rogelio driving, Staff are delivering the medicines once a month to these patients' homes, even though the clinic is closed. Preventive care, which had been an integral part of our dental clinic with Julio, Ligia, and Fabiola, is postponed indefinitely to protect both staff and patients. From mid-April to mid-May, our dental clinic only did emergency restorative care and extractions, and Maciel and our laboratory continued to test for diseases. As many of you have experienced firsthand, gastrointestinal parasites are a problem in Nicaragua. Our lab technician was very careful in handling feces while testing for what kind of parasite might be causing diarrhea. Unfortunately, we have no tests for COVID-19. Glucose levels for both chronic diabetic patients and emergencies were monitored and tested. Our eye vision testing and glasses service with Christina is on hold temporarily, as are all our normal support groups, such as our girls and boys group, all our mothers groups, breastfeeding group, our asthma group, as well as training classes with Yesenia and Amir for our 30 lay health promoters to remain the eyes and ears of public health outreach, notifying clinic staff of illness within their neighborhoods. Our therapist, Dr. Domingo, continued to treat people in the clinic. Because virtual counseling isn't an option, she and the patients were maintaining social distancing and wearing masks. Mental health is a critical service, especially when dealing with domestic violence, poverty, and the added stress of COVID-19. Most of her clients are women and children. Barring holidays and vacations, the Nueva Vida clinic has always stayed open since its inception after Hurricane Mitch in 1998, during floods, other hurricanes, earthquakes, and even the riots during the political unrest of 2018 when gangs wreaked havoc. Always. Closing now was a difficult but also an obvious decision. We want to care for people, but we feel a huge responsibility to our staff and to not infect our patients. We are all facing fears with this pandemic, but we don't have to let fear dictate our decisions, and we are not in this alone. Together, we can make a difference. Together, we can provide care and support to farmers, including those up at El Porvenir, even though more and more limited funding has stretched our budget to a breaking point. Together, once the COVID-19 peak is over here, we can again provide health care while protecting our dedicated clinic staff, even though it is a challenge to say the least. Together, we can protect our wonderful dental staff while still providing dental care, regardless of our fear. Together, we can offer mental health, and even with masks on faces and no hugs for the kids who desperately need them. Together, we can set up and maintain protection for our clinic staff and our patients in spite of the cost. And today, with your help, we can continue to pay all the staff their full salaries and pay the ongoing bills. Although all of this is hard and sometimes seemingly impossible, but as you have experienced, the CDCA has a fantastic staff full of loving, caring people dedicated to the service of the poor and making options possible for them. You have helped and seen with your own eyes. Will you help again? For just $10, you can provide washable masks with a replaceable filter for a medical provider. For just $25, you can provide one patient with their monthly diabetic medication. For just $30, a medical provider can have a set of washable gowns. For $50, a woman trying to be responsible to herself and her family can receive a birth control implant lasting 3 years. For $75, bleach disinfectant for the clinic's monthly needs. For $100, a hypertensive patient dependent on consistent medicine for life can receive 1 week's supply of medication. For only $800, you can fund Nueva Vida clinic operations completely for 1 day. And better yet, A recurring monthly donation of any size allows the clinic to plan for the best possible service for all. It's easy to set up a recurring donation online. You can help. Together we can bring hope in the midst of COVID-19. Our web address is at the bottom of the screen, and snapping the scan code on your phone will take you to our donation page. We need you. Please help. Thank you so much. And I'm going to turn off this presentation now, and we'll open it up for questions and answers. And I believe that Becca is going to host that.
Hi, everybody. I see that Mike is raising a hand. Mike, do you want to say something?
Yeah, I just want to say I need to go switch off with Kathleen so she can come see all your smiling faces and say hello to people for a few minutes. So if there are any questions for me, if you'll ask them quickly, then I'm going to go and take care of Kathleen's mom while Kathleen comes and is part of this for a while. It's great to see everyone. Bye.
Hi, Mike. Good to see you.
Good to see everyone.
All right. So if you have a question to ask, you can use the raising hand function, or you can just unmute yourself, or you can send it to us on chat. It looks like Diane has asked a question, and I'll start with that question. She asked, has Cuba provided any medical brigades to Ciudad Sandino, especially since COVID-19? Not that I know of specifically to Ciudad Sandino. I don't know if anyone else knows, Sarah, if you know any Cuban delegations to Ciudad Sandino. I do know that Cuba has provided delegations, brigades of medical personnel around the world to combat COVID-19, and that they did send a delegation to Nicaragua to help. I don't know exactly where they are or if they've come to Ciudad Sandino, but that I know of, they haven't been here specifically. Kathleen, it looks like Kathleen joined us. Hello, Kathleen, with the name Mike Woodard. You're on mute, so if you want to talk, there you go.
I said I'm now Mike Woodard. I wanted to say hi to everyone.
Hi.
So
Hi.
Kathleen, if you can see all the little pictures on your screen, you have to go left and right to get everybody because there's 2 screenfuls.
Wow. Hi.
Hello.
Hello.
Hi.
I'm not sure
Hi.
who you're listening to, but hello.
Hi. I see Karin and Ron now. Hi. Hi, Kelly.
Hello.
Hi, all of you.
All right.
Who else is here? Wow. Thank you all for joining.
Good to see you.
It's good to see you too.
I have a question.
Yes, someone is asking a question.
Yeah, I'm Joyce Stewart from Knoxville, Tennessee. How hard is it for you to buy PPE there? Masks, things like that. Are they available, or do you have to go order them from another country? Or
Yeah, so there's a couple of things that are happening. One is that within the country, there in general, supplies have been pretty steady. So for example, we didn't have a run on toilet paper the way that y'all seem to have had in the States.
who knows?
Some problems don't translate so well. But we haven't had, some of those supply chains haven't been affected. In terms of PPE and that stuff, it's really been hit or miss. When there's a shipment in, I'm talking disposable PPE that has to be brought in from outside the country.
Right.
When a shipment comes in, everyone kind of hears about it, and it hits the shelves in various pharmacies, and then the price has gone up a fair amount.
Here as well.
So for private private clinics like our clinic trying to get PPE. It's available, but it's expensive. So what we
Right.
did was we actually purchased, we hired local seamstresses to make masks and to make gowns and the jackets for our staff, because the cost of a disposable mask was about 4 times the price. One disposable mask of the surgical kind,
Wow.
not the N95,
Right.
was about
Right.
4 times as much as it was to purchase a cloth mask that could be reused. So we've actually
Wow.
had cloth masks made from surgical cloth that have space for putting a filter in them.
A
So
filter.
they're
Okay.
pretty good masks for what they are. And when the clinic opens back up, we'll have gowns for all of our medical providers as well, enough for them to be changing those out during the day. And we have a washing machine at the clinic, so all that stuff stays at the clinic and gets washed and cleaned on site rather than taking it away. In terms of
I have to add, Dave, Becca, the face shields that you saw in the presentation. So we made those out of old overhead projector transparencies that
That's
for 20 years. And we
very
cleaned them
innovative.
and made face shields out of them.
Wow.
And our doctors who work in the Ministry of Health were thrilled with them, and they were taking them to their job at the hospital as well because they were so excited to have the face shields. So they were very affordable, turns out, to make out of those old overhead projector sheets. In terms of like what the public system and the hospitals have available, as far as I have understood, the public hospitals do have enough PPE for the places that are dealing specifically with COVID-19 patients. But on, kind of getting by with the fingernails, they
Right.
always use more. And we've been contacted through our Rotary Club has been contacted by the Ministry of Health asking for donations of all types of PPE, of cleaning supplies, and that sort of thing. So we know that there is a big need for it. There have been donations from various countries. Taiwan has donated a lot of PPE. South Korea has donated the tests. So that's been very positive, but it's not quite ever enough would be the answer.
Yeah.
Okay. There is Sarah Paul Lewis, who better known in our circles as Paul Lopez from Lopez Island, is asking us to share the donation address in the chat. Would you be able to do that, please?
Sure.
And let's see, Jill is asking, have children been getting sick? I've heard some people say the number of cases is starting to fall and people believe this is going to be over for Nicaragua in July. What is that based on, and do you think it's accurate? First question of have children gotten sick? We haven't heard of personally people that we know, children with confirmed COVID-19. I'm sure there's kids who've been sick and probably kids who've been asymptomatic as well. But we haven't heard of, I imagine that if there was a case of a child dying of COVID-19, that would probably make the news, and we haven't seen that, luckily. So that's good news. The cases have been falling the last couple of weeks. The number of new cases has been falling. We do understand from some contacts within the Ministry of Health that the Ministry of Health is actually moving some of their personnel where it's been concentrated in Managua. They're moving some of their personnel out to the other cities to help them combat the COVID-19, which makes us think that maybe the peak in Managua, they think the peak in Managua has hit, and we're on the downslide in Managua, especially, which would be excellent news. The number of people recovering, of course, every week is much higher. And the number of deaths has remained pretty stable at about 9 per week for the last 2 or 3 weeks.
But the number of active cases from last week's announcement to today's announcement dropped by a fourth.
Yeah. Last week, the new cases, we get the cases reported week by week here, and last week the cases were 459 new cases, I think, and this week it was like 359, something like that. It was much fewer. So if that continues, that's a very good trend. We hope that continues. Kathleen, I see you have your hand up. Would you like to speak?
I do. One of the things that I think we need to, though, understand is like with every country, every government, that unless they don't test it and get a positive back, then they don't count it. So it could be that we're still going to see a good many cases in the next month or so, because that tends to be what we're seeing in other countries too. We do know that not everyone is getting tested like in the United States. And I don't know how accurate the tests are, because I know in the States, a lot of the tests are given false negatives. So what the government is counting, like every government, are people who have COVID-19. They have tested it and the test has come back positive. We are seeing increased burials from that we hear from other people. My guess is that in the States, when somebody dies of COVID, respiratory illnesses, their corpse usually goes to the hospital or body. Here, that is not what happens. If somebody dies here, they're buried within about 24 hours and they don't go to the hospital, and they're not going to waste a test on somebody who dies. So the numbers aren't quite accurate. I think probably the truth is probably between what the government is saying and what opposition people are saying, because I think opposition people are increasing the numbers way too much. And I think the government is sticking strictly to who they test. And
yeah, we do know that people who are being tested mostly are people who have pre-existing conditions, some kind of other chronic illness, are the folks who are mostly getting tested, which tends to skew the numbers then, because people are more likely to die if they have a pre-existing condition. So that if the only people who are getting tested for it are people who already have those conditions, then that doesn't give a very accurate picture. But I think every country around the world is facing those issues. There's another question here from Margaret asking, are people receptive to wearing masks if they have them? Luckily, Nicaragua is a country full of seamstresses willing to work, and people have been, and entrepreneurs. So people have been making those masks like crazy. People are very receptive to wearing masks. I was just drove past the market in Ciudad San Nino the other day to kind of check out what the scene was there. And it looked just about as busy as regular. We haven't shut things down here. People need to get out. But in that concentrated area where there was so many people, 97% of people were wearing masks. I saw very few people who weren't wearing masks at all. Then as you get away from the market, there were more people kind of hanging out near their house out in their front porch that weren't wearing masks. But basically everybody in other places, out in the commercial districts are wearing masks. In Managua, there's a number of businesses that have put up signs that it's been since the beginning of COVID-19. This may surprise you in some areas in the US, that all staff in all businesses have been wearing masks. They have thermometers to check your temperature when you go into any bigger institution, government institution, grocery stores. Just about every business has a mat outside with disinfectant for your feet, and they all alcohol spray or alcohol gel your hands when you go in. And now there's a lot of businesses that have put up signs that say they won't serve you if you're not wearing a mask, because the staff have been wearing masks, but not all of the patrons had been. So that's a very positive sign. Are you raising your hand, Al?
Yes. Am I being approved by the teacher? Or?
Yes, I recognize you.
Well, here in the States, as many people probably know, I mean, the woman that was doing statistics for Florida claimed and was able to prove it that the state had been totally minimizing numbers here. And then they went ahead and opened up everything under pressure from the White House. And then all of a sudden now they have extremely rising cases. And we here in our city in Western Wisconsin, we thought, I think after we thought there was going to be a big surge and whatever, and the hospital's going to close down, put people on furlough, didn't close, but they slowed down, put it that way. And now today we had 21 new cases, 15, I think it was yesterday, 8 the day before. So now we've basically doubled our numbers in a week. And other states have seen this phenomena too. So we are still basically, in order for me to get tested, I had to go and actually work with the people that were doing the testing, because otherwise without symptoms, you can't get tested. So even with all of the numbers of people that are being tested, we're not testing nearly enough because the tests weren't available. We know that some of them were inaccurate. And on top of all that, a lot of people, even if they had serious symptoms, like some friends of mine here, were told at first they couldn't be tested, just go home and wait it out. And I guess I got involved and insisted that they go in and that they be tested and that they be allowed to be tested. And then they tested negative. Well, okay, fine. But then the hospital didn't go ahead and treat them or talk about, pneumonia or anything else. So we don't know what they had for that 2 to 3 weeks officially, but there's probably a pretty good bet that they had COVID. But now the question is, some states are putting in presumptive cases, some are not. And now they've decided that the first person that really died of it in the country probably was COVID, because they went back and tested the woman's corpse in California.
Well, I think that, Nicaragua is facing all of the same, reporting issues as all the other countries. One of the things that's been brought to our attention here is that a lot of countries are reporting, me who never took statistics in college is learning a lot. Now everyone's an amateur statistician and an amateur epidemiologist, but that people are reporting the lethality, reporting the number of people who've died from COVID-19, percentage of the people who've gotten it, as opposed to reporting the mortality, which is per 100,000 citizens, which is a more accurate way to report it, because you can't, like we've just said, you can't test everybody. There's a lot of asymptomatic cases. So all these questions are, I think, just as much a jumble for Nicaragua as other countries. Kathleen, your hand is still up. Do you want to say something?
Yeah, I do. One of the I wanted to say 2 things. One is wearing masks here is only if you can get them, and most people can't. Like Becca said, it is not a political statement to wear them or not wear them, like it has become so much in the United States, which is too bad.
Right.
The second thing I wanted to say is that we had the opposition that is in Nicaragua has been inflating numbers and reporting things that are not true, basically. And one of the things that they reported was that the hospitals were completely packed. So a good friend of ours went with her daughter to the hospitals to see were they really indeed packed, and they were not.
Right.
So you can't really take what the opposition, or let me clarify that, what international news by and large is saying about what's going on here.
Exactly.
And that brings me to a question that Susan and John asked, which is there enough room in the hospitals? We have had friends who've been to the hospitals with COVID-like symptoms in the last couple of weeks, who've reported they got seen fine, but because they weren't people at high risk, which is with pre-existing conditions with diabetes or hypertension or something, they were not tested, but they were given medicines for respiratory issues they were having. As far as we've talked with folks who've spoken with people who work in the hospitals. How's that for a thing? Our doctors who work with MINSA are all out with COVID-19, so they can't tell us what's going on in the hospitals. But other folks have told us that the hospitals are functioning, people are coming in, there are cases of COVID, but they're not at capacity, and they're not, it hasn't meant the breakdown of the public healthcare system. There is still space. People should still go to the hospital. And Jill is asking a question there about whether people are still afraid to go to the hospital or the doctor. Unfortunately, that is something that we've seen a lot here because there's been so much misinformation. There's been a real campaign to say that from the beginning, from people who are opposed to the government here, to say that this COVID-19 is going to break the healthcare system in Nicaragua. In April, they were predicting, or March, they were predicting that by May there would be 250,000 cases in Nicaragua. Obviously, we've got 1,661 this week, so that hasn't proven true. But because there's been so much misinformation about what was going to happen, people are very afraid. We know people whose family members have gotten sick, and instead of going to the hospital, or there's a free phone number you can call to report your symptoms. And then as we understand the protocol, if you call that number and say, this is who I am and this is where I am, and you report your symptoms, the Ministry of Health will say, yes, that sounds like a possible COVID case. And they will ask you a lot of questions about your health background. And then based on that, we'll tell you either to stay at home and what medicines you can get, or come in and get medicines at your local health center, or yes, you need to come into the hospital. And if you're at home, they will assign a doctor to you to be calling you on the phone and checking up on you. So that's a way they're working to try to keep people who are at low risk out of the hospitals, but still be tracking them. People are afraid to call that number because they believe that the Ministry of Health will come and take their family member away, and then they will die and they'll never see them again. They'll be buried without them knowing. These are the fears that people have. And they're afraid that, by going into the hospital, they'll die in the hospital. So we know people who've spent hundreds or thousands of dollars to keep their family members at home, buying all kinds of medicines and doing all kinds of private care as well, taking them to private hospitals or to private clinics to get x-rays and things like that, that they could have gotten for free in the public system if they weren't afraid to go into the public system. And so it's a real shame. And unfortunately, I think that the false information that's out there is costing lives. We're still seeing people preferring to be at home. Some of that is a preference, just people don't want to go into the hospital. So for families that have the capabilities, they are looking after their family members at home. But what we've seen, what people have reported to us is that the hospitals are not full to capacity. And if indeed the Ministry of Health is sending some of their personnel out to other cities outside of Managua, that means probably that the hospitals here are in fact clearing out a little bit as well. So,
Becca,
yeah,
I want to switch topics a little bit because Chris asked a question. He says, they say ventilation can be important in altering virus risk. Is that a feasible project area for improving chances to reopen clinic services? Chris, can you unmute yourself?
Hi there, yeah.
Yeah, so what do you mean by this? To have more ventilation?
Well, apparently they had some situations like in restaurants in China where they figured out that the flow of air you could attribute transmission of cases through the flow of air. So that sounds like something a clinic might want to think about.
Have a pretty open air clinic, but the rooms that are air conditioned are quite closed off because we try to keep that cold air inside. So that might be a consideration. One of the things that we've heard from folks elsewhere that was recommended to us was also, seeing patients in one room and then like switching rooms and cleaning that room, having one doctor in 2 consult rooms so the room could be cleaned in between patients. When we had the clinic open and we had patients, we're trying to send patients with symptoms elsewhere where they could be seen because we're just not set up for it at the clinic. But when we did have patients that came in and turned out they had symptoms, COVID-like symptoms, we had the Rogelio and Lucas came in and fumigated with bleach after those patients were in the clinic. So everybody went outside and they fumigated the whole clinic, and we were fumigating 3 times a day. So it is sort of a constant battle. Any of you who work in healthcare probably know more about that than we do. It's a constant battle.
Thanks.
Have we missed any other questions that were in the chat that people typed in the chat?
Yeah.
Jill asked one. Jill just asked one.
Yeah, do you have any feel for whether private hospitals are giving good treatment? Has anyone noticed a different death rate in the public versus private hospitals? You know, I don't think any of us have that information in terms of where people have died. And as far as we know, the private clinics and hospitals don't have the capabilities to test at all. So I think they're going on presumptive cases because they don't have the tests. And we don't have, you know, anyone who dies in their hospitals wouldn't be reported as a COVID death because they wouldn't have been tested. So I don't think that's possible to tell. I did receive an email. We received an email from the hospital where they'll give you 12 months of interest-free credit to get liposuction. Fancy hospital. Sent an email saying that they have a whole wing of their hospital now dedicated to COVID-19, and they've got all the, you know, bells and whistles of, you know, modern fancy treatment. I understand that it costs upwards of thousands of dollars to begin your treatment at that hospital, and I don't know how many people are doing that. We have a friend who went there and said the place was empty. So either everyone was tucked away in the COVID wing, or nobody was there taking advantage of this service.
For those of us that are maybe trying to lose a little weight, could you post that address of that liposuction clinic?
They own the bank as well as the hospital, and
Okay.
they won't give our farmers credit for planting beans, but they will give you credit to get.
They don't need my money, yeah.
Yeah. Jill, looked like you were gonna add something.
I was, but it just went out of my head. It'll come back to me.
That's okay. Does anyone else have questions while we're on questions? I have a full view, so I'm not sure what time we have now. It looks like we're getting to wrapping up time. So if anyone has any last comments or questions, Sarah and Kathleen, I don't know if you want to add anything in.
I just wanted to compliment you guys for all the work you've done. Comparing what we hear in terms of the planning and the execution to what we see here, you guys are way ahead in so many ways, including the creativity in seeing to it that services can be continued in a different way, like bringing medication out. And here, you know, the hospital is closed down. They didn't take any people in. They stood empty and governed by fear, mainly. And a lot of people who were ill were not getting any care because there was nobody there to care for them. So now we're going to have this backlog of illness and needed services that people have not gotten. And I'm sure that will happen to you too, but the effort that's gone into what you did is amazing.
Thank you.
Thank you.
Any other
Bravo.
final comments or questions?
I
John,
just
you have a question?
I want to say, we'll go back to John, but I just want to say that we decided to pitch this Zoom event towards former volunteers because you all have made this happen.
I just wanted, this is John Lowery, just wanted to say thank you for the presentation and the information this evening. And
Yes.
meeting all of you, and Becca, always a pleasure to see you again.
Good to see you guys.
Yeah. As far as donations, is it better to do a monthly so you can kind of plan your budget and know what's coming and have an idea of than just intermittent donations?
we will take it any way we can get
Well,
it.
I know that.
But having it come monthly does mean that if we have a consistent amount that's going to come in every month, then we can say, okay, that's going to be able to cover this. So therefore we can do X, Y, or Z. But on the other hand, the unexpected, all of a sudden ones are also wonderful, because then we go, oh, great, we can do this thing that we were planning on doing.
Yeah.
So it's kind of hard to say, but we do like to have the ongoing monthly donations. And let me just ask, because a lot of you are folks who give online monthly like that, you should be getting an email back that's a thank you, that gives you like a little update. Are you getting it when you give your donation online? Diane's given us a thumbs up, because Kathleen bothers to write those every month so that you get new news. And I don't know if they go to your spam filter or whatever. So I hope you're getting them to stay up on that.
When you designate what you want it to go for, you don't have anything that says what you feel like you need it needs to go for.
Anything that's on that list.
Option it.
Yeah.
I mean, it doesn't matter. I don't care. Whatever y'all think you need.
Thank you, Joyce, and hug everybody in Tennessee for me. I miss being with you this
I
spring.
wish we could hug each other. It's been strange.
Thank you guys for doing this.
Yeah, thank you so much.
Thanks a lot.
I've enjoyed it.
Congratulations.
It was very informative.
Congratulations, Margaret, to your wedding with Greg. Margaret and Greg gave wedding gifts to us for their wedding last week, which is very sweet, too.
Oh, so you're married?
Yeah, she's an old married woman now.
Uh-oh.
You want to show everybody your bouquet again, Margaret?
Yeah.
She's got it. She didn't have anybody to throw it to, so she gets to show it off.
A social distance wedding, there wasn't really guests, so here it is. Yeah.
Oh. Where? We can't see. Up to your face. There we go.
Oh, that's so pretty.
What? I can't
Lovely.
see. She has to talk, so she'll come up on the screen.
I
Congratulations.
say too, just to add on that I just am so impressed always with y'all's staff. I think it's important to note that nowhere in the world is there any treatment for COVID-19. So really no one has any idea what they're doing in treating this. So
that's
I think
true.
sometimes we're unfair in criticizing other countries, but like realistically, I work in a COVID ICU and we have no idea how to treat this, and our tests are still really inaccurate. We have people who are in the unit who've tested positive that come back negative and then positive again and then negative. So great job. Keep up the good work. Don't get frustrated.
All your hard work. Thanks for not giving up on the people of Ciudad Sandino.
Oh, never.
Nice,
Hey, kids.
nice to see your.
Okay. Well,
I
don't
have a question.
Ask away, Barb.
Is this presentation being offered primarily or only to people who are already familiar with the work of the clinic? Or is it being, basically I'm wondering if I could get a friend of mine to watch it who might be able to get her church involved.
Sure.
So.
Absolutely.
Deliberately put in the names of staff and phrasing that reflects people having been here or who know us and have been part of it for a long time, but there's no reason somebody else can't watch it as well. So if you will email me and say, when you've got the videos, we want it, then I can flag that and make sure I get it to you.
Okay.
Hey, Jeff.
Hillary, you have a question?
I do. I was just wondering if that last graphic that you put up with the different amounts, is that available anywhere else, like on Facebook, or is it on your homepage? Or because that seems to be something people can really relate to if you really monetize all the different things.
I believe I can post it to the Facebook.
That would be awesome. I'll be happy to share it if you do. That would be great.
Sure, absolutely. Yeah.
Medical question. Do you know if they've seen any of the multi-system Kawasaki-like disease in children there in Nicaragua? Have you heard any reports of that?
We've not heard anything about that. No, we haven't heard even many cases of children who've been sick. There's been a few cases of relatively young people who've died, but adults, relatively young adults. There's been no reports of children who've died, and no reports so far of kids with these symptoms.
That's good. That's all the asthma that at least it puts people at risk for
Right.
More severe respiratory.
Right.
And I assume they probably don't have any of the IV antiviral that they're trying here to treat the people in ICU.
I don't really know what people are being treated with in the hospitals for sure. We've kind of got like a list of meds that people are recommending, but I don't know that that's exactly what the Ministry of Health is treating people with.
Tell them not to inject bleach. It's not recommended.
Oh, really? Because I heard that was recommended. Yeah.
Yeah, that was our national expert, but we're not.
That was recommended here in the United States. So,
is there any outlook for increased testing capacity?
I don't know about that. What we've heard now, Nicaragua got a donation of a total of 52,000 tests at the beginning of the pandemic, and they already had some previous to that. So I think we got those donations in March. We don't know how that supply is, if there's been more that have been sent. We do know that the MINSA clinics are the only ones that have the testing capacity, and they're prioritizing tests for people who have other illnesses, chronic illnesses, and other factors that put them at higher risk. So not everyone is being tested. And I don't know about, there's been donations of other equipment coming, but not the tests as far as I've heard.
Now, early on, there was some mention about reliability concerns. How accurate do the tests you have seem to be?
They're as accurate as anywhere else.
Exactly. That's part of the problem, is they're just as inaccurate as everywhere else as well. And we understand that everywhere is having the same issues with reliability of testing. We've heard from some folks in the States that the same patients, depending on the day, can test positive or negative. So we have those same issues here. But there is, there's relatively very few people who are being tested here, much like it was in the beginning in most parts of the U.S. So.
How widespread is mask wearing?
It's actually huge. I was out a few days ago over by the market in Ciudad Sandino, and that concentrated area of people was just about as busy as it always is, but everyone was wearing masks. In that section around the market and around there, it was 98% of people were wearing masks. The further you got away from the market, the closer, the more spread out people were, and the more people who were kind of just, near their homes or whatever, there were fewer people wearing masks, but it's big. People are really, there's not the resistance to wearing masks here that we've been hearing about in the States. It's not necessarily a political statement to wear a mask here or not wear one. And because, there's a seamstress on every corner capable of making masks, you can buy them. We actually purchased masks for our staff, cloth reusable masks, at a third of the price of what one disposable surgical mask is costing right now. So it's generally 30 to 50 cordobas for a mask, which is, $1, $2. So just about everybody has masks. That's not to say that they're all wearing them the way they ought to be wearing them, but it's getting much better. Yeah.
Well, it's not adopting the strategy of if you pretend it's not there, it doesn't exist. So that's good.
Yeah, well, and because things haven't shut down here, people are, people are not going out as much. People are limiting their contact with other folks. They're pretty good about keeping distance when possible, physical, distance. But I think everyone's realizing they have to adapt to these, to masks and social distancing and washing of the hands, because they have to kind of continue with day-to-day life. And so, so people have gotten used to that, I think.
Are the clinics, are the government clinics continuing to immunize the kids, even though some of them may have curtailed services. That's one thing we've tried to do is make sure kids are still getting their immunizations.
Right, yeah. And in fact, in April, the government did their vaccination campaign, their annual vaccination campaign, where they vaccinated 2 million people. And that was door-to-door vaccinations all over the country. And then they had, you know, at each health center, there were people who were being vaccinated. They did flu shots. We all got our flu shots, and they were doing some pneumonia shots as well for patients more at risk. They didn't have enough for everyone. But those are being manufactured in Nicaragua now, so those are more readily available. Sarah,
hang on a second, Becca. Mike got locked out. He tried to join us late and he couldn't get in because we got spam. So let me change my ears to him.
Hi, everybody. I just wanted to say, hey, I'm in another part of the house trying to sell coffee to the world, so I can't stick around. But it's great to see you. Hi, Janice. Hi, Bill.
Hello there. Good to see you.
Hi, Hillary. I already said hi to Bill.
Well, you can say hi to Jeff.
Hi, Jeff. Okay. Hi, Becca. Yeah, I see you.
Hi, Mike.
It's great to see y'all. Thanks for tuning in.
This is Pat and Derry.
Pat, Derry, hello. Sarah's now directing me to each person individually. Hi, Carl, and anybody else on this call. Buy lots of coffee. Bye.
Y'all have other questions?
I'm just wondering if I know you need money, obviously. Do you also need folks to send PPE to you when the clinic reopens?
Right now, just because there's no flights coming in or out of the country, that means that we can't just throw it in somebody's luggage and send it down. And trying to get PPE in through the customs and so forth is actually a lot harder. We did manage to get some infrared thermometers through a company that we ordered them on Amazon, and then they're shipped down here. And we paid a little bit more for that delivery. So we were able to do some of that, but shipping PPE right now is really not logistically possible. We just need to buy it here. And when we're looking at, you know, the cost of disposable versus reusable, we decided to go ahead with reusable gowns for all of our providers. So they'll have enough gowns that they can switch out between patients if necessary, and they can all be, we have the washing machine at the clinic, so those things can be safely washed at the clinic. The masks can be washed at the clinic. The caps as well we'll be using, and that's all washable. Because all three of our doctors got COVID, that we're having to look at, you know, as things, you know, as the virus progresses here, when are we going to be able to open back up in terms of when it's safe, but also when is our staff going to be able to see patients again? Elizabeth and Victoriano are both back at work with the Ministry of Health now. So that's our general practitioner and our pediatrician. Jorge works full-time with us, our radiologist, and he is, he's still at home, obviously, recovering. So we're looking at those factors as well in terms of opening back up. But yeah, we will have some equipment for everyone, but we're not looking at purchasing like the disposable stuff at this point because of the cost difference, and because we do have the conditions at the clinic to be able to switch it out frequently enough and wash it safely there instead of them taking it home. At this point, yeah, it's really all the containers that have been coming have stopped because the organizations that ship stuff, Hillary knows this, can't get together and pack a container. So that's complicated, and then getting things through customs right now is a little bit complicated. So it's a much better, it's just a lot cleaner to buy things here.
I just had an email communication with Austin from Peaceworks yesterday. They were unable to send their May container because, you know, everything stopped. They are hoping to send their October container, but they'll make a decision definitely in September. So they're on a wait and see for that, and have the stuff, I assume, that was supposed to come in May overwhelming them at the moment. Maybe people didn't actually show up to deliver. I don't know, but they're likely to be having a backlog of the May stuff that they have to get on first. But currently they are still hoping they can send one in October, but it's not definite yet. Hillary, that's particularly for you in terms of your, Hillary, for the rest of you, Hillary has been our point person for Mission Central in Pennsylvania, a Methodist collecting place for donations from churches and districts and all of Methodists. And she rallies up Bucknell volunteers and church volunteers and pickup trucks and drives stuff up to New Jersey on loading day to get us more desks and file cabinets and things like that down here. So thank you very much, Hillary.
Janice, are you making masks right now?
Yeah.
Good job. How many have you made so far?
Well, I've probably made over 200, but locally in central Pennsylvania, there's been a group that's providing them to essential workers and stuff. So that group has probably made over 2,500. So.
Wow. Good job.
Great.
They've also been doing face shields. Some of the students have been using 3D printers to make pieces to face shields, and then they're also sewing long surgical gowns for folks as well.
So do you have hiding in your archives at Bucknell old overhead overhead projector transparency films? That's what we used to make our shields out of here.
Yeah, I saw that. Yeah, I'm not sure they're using those, but they're working with Geisinger, our regional teaching medical center, to create some things to help. So they even, some of the students in biomedical engineering even created a special shield to go over a patient when they're being intubated to protect folks. So
right. Our Rotary Club donated a bunch of those to the local hospitals here. I think we donated 30 of those total. So yeah, very cool. Are there other questions from folks? Bill, are you seeing a lot of kids with the symptoms?
Our clinic is kind of separated out. So for the most part, if we have a kid that we highly suspect may have COVID, there's a special fever URI clinic that we send them to. They can get screened and checked there, but we still see kids who come in with fever or earache or something. So we have some, and we have actually several moms that have delivered have been positive for COVID. So that's an issue. I think there was one 5-week-old that had COVID, was in the hospital, had the whole septic workup thing, but ended up doing well. We haven't had much other serious illness in children. I think in Iowa's had one case of the multi-system disease, but basically we're seeing a lot that we know of and a lot that we don't know of. That's why you have to take care of well child's come in and you find out that the mom was positive or something. So that's why we have to take all the protections.
Right, exactly.
Well, since what we have here is Old Home Week on screen, how are y'all doing with everything that's going on in the U.S. with all the protests and everything mixed in with COVID? What's happening with you and yours? Barb, I bet you're involved in crisis stuff.
Actually, Bill and I have spent most of our time volunteering with a testing center in Greenville, where the orders for the tests went out under Bill's name, and then he contacted most of the positives except the ones who didn't speak any English. And I contacted the negatives. Now we stopped with it started out for first responders and healthcare workers, and then gradually that definition expanded just a tad unofficially. And then the last week we did it, it was a community center. and we averaged 200 people a day during that week. Yesterday, and that ended June 5th. Yesterday was the first day I didn't receive a call or a text asking for something from one of the people. And I got one this morning. So.
But during our time doing that, we were responsible for a little over 2,300 people being tested.
Wow.
So, particularly that last week beat us down pretty well.
Yeah. Wow.
But I could handle all the negatives in Spanish very well. And towards the end, what we were doing, because interpretation was hit and miss, sometimes we could get it, sometimes we couldn't. And so with the positives, we had handouts that had been translated by an LPN who knew some of Bill's original language was a bit too stilted. They got a letter from Bill in Spanish. They got an email. They got handouts. One was taking care of yourself, taking care of other people, and about return to work. And so those were mailed out. If I could successfully get an email, I now understand correo electrónico. It came up on my phone automatically without going to the Spanish a couple times. And but that was hard. Once I got people to text me that, it went better, but they didn't always text me the right email either. But we improvised, and I know it made a huge difference for a lot of people. And you know, so we're back now to staying home.
But it's been a bit frustrating going to the grocery store, and about the only people wearing masks are the people that work there. Probably 90% of the people that come in they don't pay attention about how close they are to other people. Just a huge denial of it being an issue. You know, it's just become such a political statement. You know, if you wear a mask, then you're anti-Trump.
Yeah. So it's hard at work with spending the whole day, you know, gowning up, doing all this stuff, worried about spreading it on. And then, like you say, you have to go to the store or something and nobody's paying any attention. But that kind of drags down your psyche a little bit.
And as a result, our case in South Carolina of numbers and hospitalizations is going up very rapidly.
Yeah, here in Pennsylvania, I mean, we had a governor who was trying to create some safety measures early on, and our numbers had been going down. And then we reopened in 3 phases, red, yellow, and green. But unfortunately, a lot of people think that green means everything is fine now and they're not doing the social distancing and wearing masks, even though the governor has required that people wear masks in all businesses. So yesterday at our local Walmart, they're actually doing drive-through testing now, but they weren't requiring people to wear masks in the store. And I called the manager and said, the governor's order says people are required to wear it. And they said, we're getting our orders from Arkansas, you know, and the corporate business rather than the governor of the state.
Uh-huh.
Wow.
And part of what makes our challenge difficult, I had an interaction with our local politician who was real gung-ho into opening everything up full bore. And I could sort of understand some of that because keeping things closed down is going to hurt people. But part of his argument, and he was preaching this to his constituents, is that this really isn't that bad of a disease. It's not a big problem. And I asked, you know, if you could do nothing except, all right, we're going to open the economy, but please be careful, you know, do things you can do. But that wasn't in his playbook.
Yeah. One of the things that impressed me here early on was as the word about the virus worldwide started happening, before really, I mean, Nicaragua's been testing people, fever, temperature testing people coming off the airplane for years to try to control the spread of disease. Just, a pass-by thermal screen thing. But as people began to talk about the coronavirus around, and they began to mention that it was coming here and that NITSA was tracking it and all kinds of people started doing creative things in their own little world. I don't know if you could figure out the bus co-op thing. They put a tank on top of the bus and ran PVC pipe down the side with a faucet down at ground level, so everybody getting on and off the bus could wash their hands. I mean, that was just that individual bus cooperative that did that. And we saw a water hand washing thing out in the country where they took an empty gallon oil plastic container, ran a stick through the handle, cut off the spout part so it had more of an open, and anchored it to a stick on the ground so you could step down on your stick on the ground and tilt the water to wash your hands, and then dangled a bar of soap off the bar. It cost nothing. And it was like, these are people being creative in their own communities, not just formal folks. I mean, Rotary here has done a lot of PPE stuff, hand washing and otherwise, in communities and schools in general. But individual people going, yeah, okay, we don't want it here. And all our staff are going, you say, how are you? When you call them, how are you? We're fine. What are you? Well, we're staying home. We're wearing our masks. Well, how about the rest of your family? Oh yeah, they're all staying home. And almost all of our staff, except for the docs that were sick already, are reporting that they're okay. Rogelio's son has been sick. He's now better. But most of them are reporting that they're taking precautions and they're staying safe. And they're doing it on their own. The education campaign is working here.
Yeah, it's not very kind, but I've wanted to design a t-shirt to wear around that says "No cure for COVID, no cure for stupid." But,
oh, I love it. I'd wear one.
It's sad to see just the permutations here. Lynn and I worked a little bit with a local organization that normally had meal programs in the church a couple blocks from us, and they had to stop doing that. But neighbors and another organization got back to just passing out meals every night on the street, and they do anywhere from 50 to 100 meals every night. It's been an interesting time too because of the parallel tangent of the Black Lives Matter, which has been going on everywhere, I guess, here in Des Moines, kind of peripherally involved. And as depressing as everything is, it's also inspiring to see that maybe people are making at least certain people are trying to be creative with the COVID and figure out better ways to be in society. So try to hold on to that in the midst of all the other mess.
Hey, Becca, it's Jeff Bowen.
Hey, Jeff. Hi.
I just got in from a big hike, so I missed a bit. But and Sarah, hi. I haven't seen you in a long time. Great to catch up. We now have a daughter in Latin America. Hannah is spending a year in Mexico, and two of our other daughters have spent time in Costa Rica, Nicaragua, and Mexico. So we're real interested. I have volunteered there, and I'm still looking for volunteer opportunities, but I want to hear what's happening with the COVID. So thank you for doing this.
Okay. Well, we'll be touching back on that again during the question and answer period, Jeff. And then if you want to just send in the chat your email, we can send you a link to the presentation that we've been recording. So you can have that and share widely as well. But just briefly to catch you up, COVID is moving through Nicaragua, and our clinic has been closed since the second part of May because all three of our doctors got COVID-19. And so now we are hoping to open back up again next week with a lot of the same protocols we had before and more to try to keep all of our staff and our patients safe while we also try to see patients. Nora and Becky, it looked like you guys had raised a hand there. Unmute yourself, Nora. I can't hear you.
Okay. Can you hear me now?
Yes. Yes.
Okay. Would it be feasible to mask everyone coming into the clinic as well as the staff?
Yeah.
Because that seems to be the thing that's most effective if everybody wears a mask. You know.
Right. So you all know Nicaraguans and know that people are very friendly and shake hands all the time and kiss on the cheek, and that our doctors, particularly Jorge, who many of you know well, is really value relationship with the patients and the connection with the patients and the talking to the patient. And so we were a little bit, I think some of our staff were a little bit slow at the adoption of we had for a long time, it was voluntary. Here's a mask, here's a face shields, do what you can, please. So now we're looking at, things have changed drastically in Nicaragua since then. You go out on the street now over to the market and everybody's wearing a mask. They're not all wearing them properly, but I would say actually most people are, and everyone is wearing a mask anywhere where there's a group of people. I just went to put diesel in the car across the street at the bus station that sells diesel, and they wouldn't let us in unless everybody had a mask on their face. So that's the bus co-op that's telling people you all have to be wearing a mask. So people are very compliant with the mask wearing here, and we think that what we're going to do, we have some better masks for our staff made now that have a place to put a paper towel filter in the middle. And we are getting them made better gowns so all the providers can wear gowns and have a cap that will wash at the clinic. But we will be requiring, I think, patients to wear masks. We do have some that we can hand out to people who don't have masks. Probably that won't be our major priority, although we may do some handing out of masks and alcohol gel with the chronic care patient medicines that we're delivering. We've done that when we handed out the medications, when we delivered them, we gave them a bottle of alcohol gel and a couple of masks, and we'll probably keep doing that, especially to make sure that our more vulnerable patients have what they need. But I think that is a definite thing that we'll be doing. And for sure, our staff are well aware. Sarah has made wonderful face shields out of our old overhead projector. So
projector transparencies. Yep. Good
great.
use
So
for
do you have masks available to purchase to hand out?
We don't at this point. What I've got is 100 masks for all of our staff to rotate out theirs. And we're looking at, do we try to make some more masks between now and when the clinic reopens? We're looking at reopening the clinic on Wednesday, but probably won't see patients until the 6th. So that'll give staff a chance to get back in and kind of get new protocols in place. One of the things that we'll be talking about the next few days is what else we need to have in place in addition to the hand washing and the fumigating and the face masks and all of that, because Josefa has been taking care of, she has 3 sister and 2 brothers who've been ill with COVID in and out of the hospital. And she's been in and out of the hospitals and has observed all their protocols. And so now she's got a big list for us of things we ought to be doing in the clinic as well. And so we'll be looking at that too. Also, just a little update for those of you who know Rogelio and Danelia. Their son Brian has also been sick with what is assumed to be COVID, but he's doing well. He's 13 years old, so he seems to be doing pretty well. Jeff, I see your hand up.
Would it help to send you masks that we make?
At this point, we're having more trouble getting things in customs, and there are we're blessed in Nicaragua with a wealth of seamstresses looking for work. So absolutely, we can buy them for about $2, less than $2, $1.50 a piece for the masks. And we actually went ahead and purchased a whole roll of surgical gown material, and that's what we're using to make the masks and the caps and all. So we feel like that's we can get them made more easily here than we can bring them in. If we were talking disposable stuff, right now the disposable surgical masks are costing more than it costs us to get a reusable mask made out of cloth. So about twice as much, actually, which is why we're going with the reusable ones. And because we have the washing machine at the clinic, we can wash there, and people don't have to take it home and try to wash it properly.
Are you using filters with the masks?
We were not before. We now have made the masks. We have a little bit of metal in the top so that we can, it's easier to wear. With those of us who wear glasses, you can appreciate that little feature. And then there are accordion masks that go down that fit snugly under the chin and have a space inside for the filter. Yeah. So that's what we'll be using now, in addition to the face shield. So anyone who's interacting with patients directly will be wearing the face shields, which they've discovered. Thank you, Jen Aist gave us that, the links to the idea for that. That's been wonderful. And our staff have made the one change that you should cut the corners off so that you don't keep poking yourself with the corners. I see Jen has a couple of questions now. How are the doctors doing? Are they on the road to recovery, hospitalized? Is mail open now, and are we able to receive shipments? The doctors are doing better. Both Lopez doctors, our general practitioner, Elizabeth Lopez, and our pediatrician, Victoriano Lopez, work with the Ministry of Health as well. And so that they were very exposed to lots of patients in the beginning of the pandemic, and they have both recovered and are back at work at their Ministry of Health jobs. So they're doing better. Elizabeth's dad got it, and he has been hospitalized and been on a ventilator, and I don't have an update on how he's doing. Jorge is doing better. He had about 10 days where he was quite ill. He treated himself at home. And he is now doing better. All of them have, lost a lot of weight and had they all had pneumonia with it. The mail service is not open. Regular mail service is not open yet. Flights in and out of Nicaragua are still not coming and going. But we are able to receive things through a courier service, or we're looking at, there's a organization called Quest for Peace that's going to be sending us a container from Connecticut in August. And we've talked with our customs brokers here, and they think there shouldn't be a problem bringing that down. But getting smaller shipments in has been expensive and difficult because we don't have lovely volunteers bringing 25 suitcases full of stuff for us. So that's been a lot more difficult.
For example, we ordered the thermal scanning thermometers, the heat thermometers. We couldn't get them here, or they were extremely expensive. So we ordered them from the States and had them come down through a little shipping method that zipped them through Miami and down. But then we had to pay a lot to them for the fee for importing it in. So that was worth it because
it took about 2 months.
Well, no, maybe. Anyway, it was not very fast. It was not nearly as fast as we expected it to be. But we did get them, so we have them now for when the clinic opens back up, and that's very good because they were just absolutely necessary to be able to test people at the gate. And so we've done that with a few things that were absolutely essential, but mostly we have to go with the slow, tried and true method. The Peaceworks container people that ship twice a year did not ship in May because of COVID in New Jersey, and they are hoping that their October shipment will happen. And so we have was going to come in May that hasn't come because they couldn't ship, but hopefully it will come in October. And they're going to make a final decision about that one in September.
What other questions or comments do people have? Nina, you have something?
I'm curious about political unrest down there. Has it changed with all of this, or are there still those problems?
So there was political unrest in 2018, and that lasted sort of through the April to September kind of was the hot time of 2018. 2019 there was no violence, but there continued to be a lot of kind of back and forth with the opposition trying to in opposition to the current government of Daniel Ortega. And what we've seen now since the pandemic started is a manipulation of that pandemic in an attempt to overthrow the government again on the part of the opposition. So we've seen a huge campaign of misinformation, even beginning before we had cases in Nicaragua, talking about the government hiding cases of COVID-19, and then predictions that there would be hundreds of thousands of cases by May, and there's been a lot of, from early on, there's been information saying the hospitals are overwhelmed and there's no ventilators and people are dying and everyone's being buried in secret. What that has done, the effect of that has been that now people are afraid to go to the hospital because they believe that they will die and won't see their family again. Their family won't get to bury them even. So people are saying, I'd rather die at home than go to the hospital. That is extremely problematic, especially given that what we're learning now from all of this is that the sooner you seek treatment and get proper medications, the better off you are. So what we have in Nicaragua is WhatsApp lists going around of what medications you should take. And then people, because we don't have to have a prescription to go to the pharmacy here, people are self-medicating like crazy and in fact doing themselves serious damage. I was at a meeting this week with the representative from the Ministry of Health who said it was for organizations, and he said, please tell people, please try to get the information out there that we are working in the hospitals and the hospitals are not overwhelmed. We still have plenty of beds. They have 449 ventilators in Nicaragua, more, which is more than we've never had that many active cases of COVID in Nicaragua. So we haven't run out of ventilators even. And they said it's very important that people come in and seek treatment immediately and that they not self-medicate. The doctors need to say, what they should be taking based on their history and based on the symptoms they have. And the sooner you begin treatment, the better chance you have of having a more mild case and fewer complications. So they're really trying to get that out there. They have a hotline a free hotline that people can call to talk to a medical person about their symptoms and kind of get registered. The policy right now is that if you go into a medical center run by the Ministry of Health and show symptoms, you will get a test if you fall into a certain criteria. Those are mostly people who have other conditions, pre-existing conditions that could give them complications. If you are younger or don't have any other conditions, they're not going to give you a test. That's not because they don't have the test kits, it's because they're having difficulty getting access to the other reagents and things that they use to do the test itself. So they have the test kits, but they don't have as many reagents. And so they are limiting access to the testing to make sure that people who are more at risk can get those tests. If you look like you're going to have a mild case, they'll put you on medication and then they'll send you home to self-isolate at home. If you have been in the hospital and get out before your quarantine period because you're doing well, they'll also send you someone to follow up with you by telephone. So they have doctors who are calling people and checking in with them and then having them come back in if their symptoms change or if their condition changes. So the real problem right now is not, collapse of the medical system. The problem is that the perception that the medical system has collapsed, or the perception that you can't get care at a hospital. Other people are getting sick and spending thousands of dollars for private medical treatment, for doctors to come to their homes. And believe me, there are doctors taking advantage of this, charging through the nose to come to people's homes to take care of them instead of them going into the public medical system. So that has been the real problem. And to tie back in now, this is the opposition is using this moment to try to show that the government has been destabilized and is no longer effective. And in fact, if you've been following the news on Nicaragua, I have a Google alert for Nicaragua, which is just shocking. The things that are coming up on that is that Nicaragua has a completely hands-off approach to this. Just let everyone die of COVID-19. And the truth is that the government has in fact done 4.5 million home visits trying to tell people about COVID-19. So that is not the reality that we're seeing on the ground here, but it is dangerous because people believe that, people are scared and they believe that, and then they don't get the care that they need. I
was just going to say, one of the things that makes a difference for us is that we are not in an isolated bubble. 2 of our physicians also work at the Ministry of Health. Josefa, our clinic administrator, also runs a pharmacy. We have the agricultural cooperative that's all up and down the west side of Nicaragua doing, Zoom phone meeting thingies with themselves and all. So we're getting information from all over the place. This doesn't mean that we have 100% of the facts about everything, but it does mean that we feel like we kind of are getting the pulse of what people are saying. And our staff are very free to tell us when they think, something isn't working right or whatever. And we ask them and they go, oh yeah, we're all wearing masks. Oh yeah, we all know. And our family all knows. And the neighbors all over up and down the street, they all know. We're all doing this. So it's not just us in our little isolation corner, peering out across the fence and saying what we're seeing. We really are trying to stay in touch with all of our staff and what are they hearing and what are they seeing and what are they finding out also. And by and large, what we're hearing from the official meets of sources seems to be more in line with what our staff are telling us than the other kinds of reports. Oh, Kathleen's coming to say hey to you all. Just a minute.
Hi.
Kathleen.
Hi, Kathleen.
Hi. I really can't see you. I'm so sorry. I don't have my glasses.
Okay. Alexis, Megan,
Hi.
Jill.
Hi, Jill.
Laura Dunn. There's not Laura Dunn anymore there.
Yeah,
Jennifer Ice. There's Neville.
Hi. Hi.
Ian. Jeff Bowen.
Hi, Kathleen.
Hi.
Nora and Becky.
Hi.
Dottie.
Hi.
Aaron. Mina.
Wow.
Holly. There's Becca. You already know her. Kathy.
Hi.
And Molly. Rosemary. Serena.
Hi, Rosemary.
And Tom Whipple.
Wow. This is great. It's good to see everyone.
It's a great group we've got today.
Yes, it is. It really is. And Neville from Northern Ireland. Wow. Yeah. Wow.
And several from Alaska. We're quite the geographically spread out today.
Yeah. Yeah.
Who's Alaska?
Jen Ice is. And who else?
Holly.
Holly. Holly. I didn't see Holly. Hi, Holly.
She's waving.
Oh,
You
there
your
you are.
glasses,
Hi. I know. I do need my glasses. I do need them. I can't see where
they're not on top of your head. We can all see that.
Not there. Not there. Well, thank you all for coming. And there's
baby.
Ian.
There's little baby.
Oh, how cute. How cute. Well, it's wonderful to see you all. Are you all healthy?
Mm-hmm. Yes.
Good. Good. We miss you. We miss having people around us.
We miss being there.
Yes.
Come on down and I'll wave at you across the yard like I do to Kathleen and Sarah.
Yeah.
Hey,
Here's Mike. He's come to say hello.
Oh.
Hi, everybody.
hello.
How are you? Wow, look at all these people that I know. What a deal. Hello there. Hi.
It's been a while, Michael.
It
Jeff,
has, Jeff. It has.
hope to get.
You hoping, Jeff?
We would hope to get another volunteer chance down there when this blows over.
We would love that. We
So.
would love that. Okay,
Yes,
everybody.
mate. It's good to see you.
It's good to be seen. And how is life?
It's grand.
It's great.
Grand.
It's grand.
Wonderful.
You're
I know why
asking
Neville
me
wasn't
about
unmuting himself.
Brexit. It's done, Mike. It's done and over.
Well, sure. Okay. Okay. So you can now dump your pig offal in the river anytime you want?
Pig awful.
You're who?
Dear Neville, Neville is our one Brexit.
Do what?
Our one Brexiter that we still speak with.
Did we have others we weren't speaking?
Oh, come on, Mike.
It's good. Hey, Jill.
Yes.
Yes. Hey, Megan. I see your picture. I don't see you. Hello. How are you?
Good. How are you?
Good. Hi, Rosemary.
Laura Dunn.
Hi.
Hi.
Hi, Laura.
Hello.
How are you?
Hey.
Hi, Evil Jen. Hi, Kathy.
That's Tom Whipple.
Hi, Tom. I got to go. I'm trying to sell coffee. Thanks for tuning in. Y'all have a great rest of your day. Bye.
Bye. Bye.
So there's a couple more questions here. I think I answered Rana's question about the testing. Jen was asking how was attendance at the other presentations. I think
just a reminder, if people end up having to leave, we can stay and chat, all day. But if people end up having to leave, make sure you've put your full name and your correct email over in the chat, please, so that we have whatever email you're preferring and all. Okay, carry on, Becca.
So the question was, how was attendance at the other presentations? We did one presentation in early May. Was that right, Sarah? Our first one, I think there was 75 people or something on that one. Then the first in this series for volunteers, I think we had 25 to 30 people. And the last one we had about 9 or 10. And
then we had to lock it.
and then we've got 20 now. So that we felt really great about the attendance on the presentations, especially since, now at this stage, a lot of places are opening up and people are back out again. And so we felt really great that people like you all have stopped what you're doing to join or joined us after a hike in the case of Jeff, right? So that's great. Jeff was asking, are there many cases among children and youth?
Can I add one thing? I don't know if somebody said this while I was away from my earphones. But we also are going to have a recording. Claudia is going to take the presentation, this last one that's the most updated, and add all the questions and answers at the end from all 3 sessions into one video recording, so that if you want it or you have people who wanted to come but they missed it or whatever, just send us an email asking for the video when it's ready and we'll get it to you.
Okay, so are there many cases among children and youth? We know that, Daniela and Rogelio's son, who's 13, has probable COVID. There have been a few other children that we've heard about who've gotten it. According to the Ministry of Health, as of Monday at the meeting I was at, they had not had any complications in cases of children. So there haven't been any deaths in children and a few younger people have had some complications, younger adults, kind of 20s and 30s. I think there was one death of someone who was early 30s. But for the most part, we haven't seen any of the I forget what it's called, the secondary effects in children that's happening. We haven't seen any cases of that yet here. So that's been very positive. Schools are open, but kids are not going to school. Just yesterday, the Ministry of Health, we're entering into or Ministry of Education, we're entering into the mid-semester break, the between the semesters break here. And our girls at their public school, I went in instead of them, but the students could also go in to pick up homework. They were supposed to go into the school in small groups. Everyone was programmed on a different day to go in, so there wouldn't be a lot of kids there. And the teachers all had up on the board what their homework was to be, and the teachers were there to explain the homework to the kids to make sure they knew what they were supposed to do and when they were supposed to turn it in and answer any questions. That's because they're seeing, they've been doing homework via WhatsApp or whatever. And of course, kids, like you all have seen in the States as well, kids who have great access to internet and parents who can't have the time to sit down and work with them or who can help them do fine. And the kids who don't have access to internet and don't have parents who can help them are really struggling. So actually the 2 television channels next week we'll be starting reinforcement classes, and they've got scheduled in the morning is preschool and elementary school, and the afternoon is secondary school, and they have it all scheduled out which day you're supposed to tune into the channel to watch your classes on which subjects to be able to do your reinforcement. So they're really working on thinking outside the box a little bit on how to get the kids back in. And then I think the ministry's hope is that most kids will come back to school in July. So when vacation is over. So when that happens, we may see a spike in cases. They're not requiring masks at schools, although the teachers are all wearing them. A lot of the kids are not. Jill was asking, are people getting less scared to go in and see the doctor? I think my feeling on that is that people are starting to come around, but I think there's still a lot of fear for sure. And in terms of the curve flattening, what we had in Nicaragua, if you look at Sarah's graph, which we have in the presentation we'll send you, Jill, it was very low for a long time. Nicaragua was able to sustain that, few cases for a long time. And then when it started spiking in May, it really spiked. And the last 4 weeks, we've had fewer new cases each week than the week before. So you can see it kind of falling. The Ministry of Health expects it to continue. They hope it will continue to fall. They do not expect that to be fast. They think it will be a slow descension. And that everyone kind of the attitude is very much that we are just going to have to live with this virus until there's a vaccine or something. And so we need to continue doing what we need to do as safely as possible. And so there's a lot of measures being put in place that are looking at the long term. How do we do this? It's not just a matter of, well, we shut down for a couple of months and then hope it's magically going to go away. Nicaragua hasn't shut down. So they're looking at, this is going to stick around. And so we need to kind of get on with our lives in as safe a way as possible. So that's, I think that's kind of the attitude here now. And that's certainly what our staff are saying to us when we're talking with them about, do we open up next week or not? They said, this is going to be here. We just, we have to figure out how to get along with it and how to keep ourselves and our patients safe while we go back to work. So do folks have, I think there are a few more messages here that I don't see. It is possible. Laura's asking, can you connect with us for a global health class? Absolutely. Sarah and I are becoming the stars of Zoom now. We figured out how to get people from the waiting room today, so we can do pretty much anything now. We're happy to connect with classes. We would love to take advantage of that. One of the side benefits of this pandemic we all hate is that we get to do things like this where we, get to see all of you, even though we haven't gone anywhere. So that's great. Thank you, Laura. You can be in touch with us about that. And Alexis was asking, who is the opposition and how are they spreading that misinformation? The opposition is a very loose loose group right now. It's not actually a political party. There's a group of various people who are trying to spread this misinformation. There's been a group of people who've gotten together under sort of a scientific umbrella. There's another group who've gotten together sort of under a medical umbrella. And they talk about, there's one group called the Citizens Observatory for COVID-19 in Nicaragua. Every time the government comes out with their numbers, the Citizens Observatory comes out with their numbers of what they estimate to be the cases of COVID-19 in the country. We don't know exactly who these people are, how they're getting their numbers, but they're being quoted in international press, and I've even seen articles referring to them as a well-established nonprofit organization. They didn't exist before March, and they certainly don't have legal standing, and we don't know where they're getting their numbers from. But because they're getting play in the media, people look at that and go, oh my gosh, there's all these cases. The government is the only entity that's doing the testing. So, we know there are far more cases than what is showing up in the official numbers because they're not testing everyone, and the government says that. They are reporting cases where Ministry of Health doctors say this person has clinically we can see this person probably has COVID-19. Those cases are being reported as well. But of course, there's still a lot of cases that aren't being reported. So there's I guess, Jill is just saying that the observatory, it was set up by Dora Maria Tejas, who was a medical student in the 1970s and then was the Minister of Health. She's in the 1980s. She's part of an opposition party, which is one of the opposition political parties, as opposed to just a grouping of people called the MRS. And they say they have these experts. They say they have kind of undercover people working in the Ministry of Health, but we don't know who they are. And we do know that some of these groups have received funding from the National Endowment for Democracy, which is the NED is a branch of the CIA. So the U.S. government is funding these groups in an attempt to a regime change in Nicaragua, as they call it, trying to change who's in charge here, however you want to call that. Did that answer your question, Alexis?
Yeah, thank you.
Okay. I don't know if folks have other questions. I know several people have had to jump off the call as time goes on. We've enjoyed having you all here, though. It's so nice to see everyone's faces and get a chance to chat and say hello. And
thank you so much.
You should feel free to share the recording with other folks, and we'll probably do another update in a while, once we've got more to update about what's happening in Nicaragua. So stay tuned as well.
All right.
Thanks again.
Thank you.
Very much.
Thank you.
Thanks to all of you.
Bye.
So you all.